Hello, my name is McKenna Clayman, and the practice that I chose to write my systematic survey paper on is meditation. So, to begin, I'm just going to explain what exactly meditation is. And it's a technique used to help relax and relieve stress from the body. Um, Meditating, there's multiple different kinds of practices, such as breathing techniques, walking meditation, compassion meditation, and concentration meditation. So there are two types of literature, which is scientific literature and the popular literature. Scientific literature goes more into depth and shows numbers and more details, such as data and showing results for multiple periods at a time. So, one of the first scientific literature articles that I found was a study that was conducted in 2013. And this kind of research was compassion meditation. So they analyzed 39 different individuals who had to take meditation classes for an 8-week time period and to see if it had responses and see if it increased compassionate responses to suffering. So they had to take these meditation classes for 8 weeks straight, once per week. And then at the end of the trial, they conducted a study to see if patients from the trial offered their seats to a sufferer which had like a broken leg. And then results of this study showed that the patients did offer their seat to the sufferer. So, in conclusion, the hypothesis was proved that it improved compassion. Another scientific literature study that I found, it was conducted more recently in 2018, and researchers gathered about 162 German participants to see if meditation and yoga actually could quiet the ego of a human. One of the control factors were all the individuals had previous experience with meditation, so they knew exactly what they were doing before they got into it. They had a 4-week period with 4 assessments, so that means once a week they were doing meditation. And this one resulted in, actually, it didn't quiet the ego. It was found that meditation do not weaken the ego of an individual. A final study of the scientific literature was conducted in 2019 by Sage Journals, and researchers observed whether or not meditation has a positive effect on heart failure in humans. There were 6 trials conducted within this one with 320 heart failure patients, which actually came out with better results because there were so much information being provided and collected. 5 out of the 6 trials required the participants to actually practice meditation between a 15 and 30-minute time period. And then they found that the practice of meditation can reduce heart failure symptoms with heart failure patients and also induce the quality of life. So now we're moving on to the popular literature, which is not as in-depth as the scientific literature. It doesn't provide as many numbers, but some of the research that I found, the authors included research in their writings. So one of the first popular literature journals that I found was to see if meditation can reduce stress, risk for disease, and improve overall well-being. The author actually provided a study that was conducted, and in the trial there were patients practicing meditation, and then they had a set of patients who were tricked into thinking they were practicing like meditation, but they weren't doing actual like meditation. They were just having like better like routine, like sleep like routines at night. So after the experiment, they conducted scans and tests to see the effects on the brain from meditation. And in conclusion, they had more positive results from meditation that showed reduction of stress, disease, and overall improvement of well-being. Another popular literature study that or article that I had found was when the author discusses how meditation is on the come up for treating medical issues in humans. These benefits could be reducing anxiety, blood pressure, and respiratory illnesses. The author provided a study, and which was a case study which included 75 women who faced irritable bowel syndrome. All these women, after practicing meditation, reported that it decreased the symptoms and effects of the irritable bowel syndrome. And then lastly, in a newspaper article that I found on the popular literature, the author collaborated with an internal medicine journal to show how meditation, it was a clinical trial to show meditation, and they recruited about 50 patients who were older in age and seemed to present moderate sleep issues. There were 2 control groups, one of which practiced meditation within a 6-week program and one that established better routines before bedtime. In result, the clinical trial proved that the participants who were practicing meditation had decreased insomnia, but the patients who just had better routines at night, it didn't decrease insomnia as much. So overall, both the scientific literature and the popular literature provided well-trusted evidence and really went into depth in how meditation does have positive effects, and I really think that everybody should try meditation because it overall improves well-being. Goodbye. Thank you.